We have sunny skies here from WICC 600.
Tony and Mike in the morning on WICC 600. Presented by Steve Basso Plumbing, Heating, and Air Conditioning. Everything's better with Basso.
Hey, good morning. 8 minutes after 9. Tony and Mike here with you. Thanks for having a second cup of coffee with us as we head into the weekend. With us here this morning, a good friend of the station, Dr. Robert Weiss. And he is an ear, nose, and throat specialist. He's with Connecticut ENT of Norwalk. And we're going to spend a few minutes with him. Dr. Weiss, thank you so much for taking a few minutes.
Oh, thank you, Tony.
All right. Well, let's talk a little bit this morning about sinus and pressure and all of that. I mean, everything's connected. The ears, the nose, the throat.
That's right.
I know sometimes you get an earache and your throat is killing you as well.
Right. It's all actually one system. You know, we kind of divide it up into parts. Like we say, this is the nose, this is the ear, this is the lung. It's really all part of the respiratory system. So when you get an infection in one part, it can easily travel to those other parts and affect them in lots of ways.
And there are some people that are just so unlucky. They suffer with this pain, this sinus pain,
yes,
all the time.
Yes, it's really a combination of factors. It's if whether or not you have allergies. It depends on your immune system to some degree. But what we're finding lately is that it also depends on the actual structure of your sinuses. Some folks have sinuses that are just predisposed to get these types of infections, while others don't seem to get them, even though they get the same amount of colds and allergies.
Right. I had it one time, and I could have been imagining it. But is it possible to lose your hearing if it gets that bad?
Oh, absolutely. You can. Your ear can just literally fill with fluid, and you don't lose the hearing, but it's for a radio guy, you probably feel like you're losing your hearing. But even a slight decrease in a short fashion will really feel like you're going deaf sometimes. But usually it's just a backup of fluid from the sinus being backed up, and again, they're all connected, so that fluid can easily travel into your ear.
Yeah, it's a very scary thing if you don't know
sure
what's
is.
going on.
Right.
That's for sure. Now, over at the ENT of Connecticut, you have you're doing this thing called balloon sinuplasty.
Right.
Go ahead, explain that to us.
It's a relatively new procedure, but it's been out since 2006 or so. It actually is an offshoot of what the balloons that were used in the heart for catheterization. You know, before they were stents, they used to put a balloon in your coronary artery if it was blocked and open it up. So this is the same device that's been adapted to the sinuses, and it's an excellent tool for opening up those narrow passages that are either blocked or narrowed. And it's done in such a way that you don't have to do surgery. You don't have to remove tissue. It's a very much less invasive way to do it. It has a lot of advantages in the fact that many of these patients don't need to go to the hospital. They don't need anesthesia for this. This is an office procedure. We do this in an awake state. We're pretty adept at making the nose pretty numb prior to doing it, and it's very well tolerated. The other advantage is that the downtime for the patient is very limited. So you come in that afternoon, let's say, you can work most of the day, have lunch, have this done in about an hour, and the next day you're back to work. There's no bruising, there's no packing in the nose. It's very well tolerated.
And forgive me,
it's very effective.
Did you say you're awake through the whole thing, or
if you're doing it in the office, you're awake? I mean, we have the option of doing it and still doing it in the hospital under anesthesia, but the technology allows us to be able to do this in the office in an awake patient.
All right. We're taking a moment here, and we're talking to Dr. Robert Weiss with Connecticut ENT in Norwalk. We're going to tell you where he's located, all that stuff coming up in just a moment. Is this procedure for everybody or not for everybody?
In terms of ages, any adult on up. We've done adults as young as 19. And actually, this week we did a gentleman in his mid-80s. Mm-hmm. So I don't think age is a factor. It really comes down to what the particular problems are that they're experiencing and whether or not the balloon is an appropriate tool to be used. And obviously, these patients have gone through all of the medical treatments that have obviously failed at that point, and now they're a candidate for some type of procedure.
So are you saying this is kind of like a last resort thing?
No, I wouldn't say it's a last resort. I look at it as a sort of an intermediate step, because prior to the balloon, the patient would have to undergo surgery to fix these problems.
Okay.
So, which is much more aggressive, much more invasive. So this is something, really an intermediate place between doing the medical management that in these patients is failing. It's not working versus having to do more aggressive surgery.
And when you do the balloon sinuplasty, is that in addition to antibiotics?
Yes. I mean, these folks have already gone through. My typical patient has, gets 5 and 6 sinus infections a year, multiple antibiotics, steroids, decongestants. They've seen their allergist.
Yeah.
We've treated all these things already, and they're still having a problem. And that's where we say, okay, time out. Let's do something that's going to stop this cycle. And that's where the balloon can help.
And once you've had the balloon, are you good to go, or is this something that you have to do every couple of years?
Oh, good question. No, unlike some other things, this is considered a permanent solution. The openings that the balloon is creating stay open, and that makes the difference. So no, this isn't something you have to come back for every 3 months or 6 months. This is a one-time fix.
Oh, that's great. That's wonderful. I mean, the science has really come a long way.
It's really unbelievable.
And why should you suffer if you don't have to? If there's this kind of help out there, why not grab a hold of it?
Absolutely.
Absolutely. This is we're talking with Dr. Rob Weiss, a board-certified ear, nose, and throat doctor in Norwalk. Where are you guys located?
We're at the iPark, which is on Route 7, Main Avenue in Norwalk, just up the road from motor vehicle.
Oh, I know exactly where you are. Okay, all right. And there's a website that folks can go to?
There's a website. The easy one to remember is www.painandpressure.com.
Okay, and a phone number?
Well, 800-ENT-OPEN.
800-ENT-OPEN. And what's that website one more time?
www.painandpressure.com.
I've got to tell you, before you came on, about 10 minutes before, I think I maybe had 4 or 5 phone calls, people asking, you didn't do the interview yet. I want to hear this. I want to hear what's going on. So there are a lot of people out there that are suffering, that are looking for help.
Right. Well, if they go to the website, there's a lot of great information there about the sinus balloons, about everything that they may want to be interested in. So. Okay.
All right. Sounds good. Dr. Weiss, we've run out of time, but I thank you so much for taking a few minutes.
It's my pleasure. Thank you so much.
All right. Anytime. Here from WICC, where it is 9:50.